High blood pressure. Is it dangerous to exercise? Have you ever heard the saying, vitals are vital? Vital signs are useful in detecting and monitoring health-related conditions. One of the vital signs that we will be delving into today is blood pressure. Has anyone taken the time to explain to you what it exactly is? Blood pressure is the force of blood pushing against the artery walls during contraction and relaxation of the heart. When a practitioner is measuring your blood pressure manually, they will use a blood pressure cuff as well as a stethoscope along the brachial artery of your arm. What they are doing after they inflate the cuff is listening for the first sound that they hear. What this indicates is the systolic blood pressure, which is the top number. Systolic blood pressure measures the pressure in the heart when it contracts to supply blood throughout your body. The point at which the sound stops is your diastolic blood pressure, which is the bottom number. Diastolic blood pressure measures the point at which the heart is at rest and refilling with blood again. The higher these values are, the harder your heart is working to circulate blood throughout your body. High blood pressure, or hypertension, is among the leading preventive risk factors for cardiovascular disease for men and women in the United States, as well as around the world. This is why early detection as well as proper management is essential in reducing mortality rate and risk of other diseases, such as heart attack, heart failure, and stroke. Due to the nature of the hypertension, you may be asymptomatic, that is, not experience any symptoms, even at critical values, which is considered a medical emergency. Symptoms that you may experience include, but are not limited to, headaches, visual impairments, confusion, pounding in chest, neck, or ears. In most cases, there is no known cause of high blood pressure. Slight fluctuations in blood pressure throughout the day is normal to occur. The values should only be used as a guide, as it is important to consider that a single elevated reading may not necessarily merit a hypertension diagnosis. It is important to follow up with your provider if your blood pressure readings are outside the normal ranges. Blood pressure can be affected by several factors including, but not limited to, caffeine intake, smoking, diet, stress levels, and even exercise. Slight increase in blood pressure is a normal response to exercise. As such, if your blood pressure actually decreases during exercise, or increases more than 20 to 30 millimeters of mercury, this can also be an indication of possible underlying pathology. It is important to note, however, that some medications, such as beta blockers, are known to affect the typical body's response to exercising as they are doing what they're prescribed to do. So, can you exercise if you have high blood pressure? For the most part, yes. In fact, exercise training has been shown to be as much effective than other methods of hypertension treatment and management, making it an integral part of controlling high blood pressure. Specifically, an aerobic exercise program for 90 to 150 minutes per week at moderate intensity can result in significant reductions in blood pressure, and thus, your risk of disease. It is important to discuss with your doctor what your baseline blood pressure measurement is, to ensure you are within the safe range to exercise, especially if you fall within stage 2 hypertension category or above. Examples of activity to help get your body moving include walking, swimming, biking, gardening, playing tennis, and even dancing.